Hi, welcome to Mindful Conversations. I'm Greg Dwyer. My guest today is Dr. Alice Bell. She's an expert on Lyme disease. She also has a master's in nutrition, and I'm so happy that she's here today. Thank you so much.
Thank you for inviting me.
So you have a practice in Southbury?
Correct.
And also in Litchfield?
Yes.
And how long have you been doing that?
I have been in practice for 10 years. I am a naturopathic physician.
Okay.
Yes.
And how's that different from a regular doctor, or what's the differences between the two practices, I should say?
Well, a naturopathic doctor is really trying to find the original problem that started all the symptoms.
Okay.
So we try to get to the root cause of the problem and try to fix it there rather than kind of band-aiding the symptoms.
Right.
And we also treat with natural agents.
Okay.
So usually botanical medicine, supplements, vitamins. Sometimes we do homeopathy. Sometimes we do other modalities as well.
Now, are you against like penicillin? Are you against drugs? Do you not use them at all, or what's?
I'm not against them at all.
Okay.
In fact, when somebody really needs them, I refer them out for that.
Okay, all right.
Yes.
So a person could have two different types of doctors.
They could.
Okay, so
Yes.
it's not like either or, it could be
Correct.
complementary.
It often is complementary, but it also depends on what the person believes in.
Ooh, that's
so-
interesting, because now we haven't rehearsed any of this, but a lot of medicine in my mind has to do with placebos or beliefs. I mean, how does that impact a person's health as far as how they think, whether this herb or vitamin or pill is going to help? Do you think it has any?
I think it matters a lot.
Okay.
Sometimes people come to me and they need to be diagnosed, and I diagnose them with something, and then they go to the regular physician, their medical doctor, and they are treated, and I never see them again.
Which is good. Yeah.
It's good
Yeah.
if that works for them.
Sure.
And then I have other kinds of patients who come to me because they don't believe in the medical, they don't want to take an antibiotic, they
Right.
don't want any of that, any medications at all. So they do already believe in what I do, and that's
Right.
very helpful.
Okay. So how did you get interested in Lyme disease? Did you come down with Lyme disease? Did you meet someone? Did you just have an interest in it? What was the backstory on all of this?
So, well, when I went to graduate school in 2002, one of my classmates had chronic Lyme disease. Chronic Lyme disease.
And what's the difference between chronic and what is it, acute, or is it the same?
No, they're not the same.
Oh, they're not the same.
No.
Okay.
So acute means really that you've been bitten in the last year and you've been suffering for less than a year.
Okay.
From symptoms.
All right.
Chronic is much longer term than that. Sometimes people have not been diagnosed for 3 to 5 to 10 years. Then they're diagnosed, and in the meantime, they're really struggling.
But does the medical community recognize chronic Lyme disease at all? Is that a controversial subject? I'm just reading
Kind
your
of.
body language. We don't have
Kind
to
of.
go there.
No.
It's up to you.
So I think for the most part, the medical community does not believe in chronic Lyme disease.
They don't. Yeah, that's what I found.
But everyone who has family members or they themselves have suffered from Lyme disease, everybody knows that chronic Lyme disease exists. There's just, it might be harder to explain.
Sure.
Yeah.
So why do you think there's such a denial, or I don't want to say cover up, I don't want to say conspiracy, but why does the medical community say, okay, you've had 2 weeks of antibiotics, you're done, next? What is that mindset?
Because they believe that the bacteria can't really survive after those 3 weeks, 2 or 3 weeks of antibiotic. They believe the bacteria has been killed, and therefore the person doesn't have Lyme disease.
So it's mental if they have symptoms. That's what I hear.
Yes.
Okay.
Yes.
So they have mental problems. They need to see a psychiatrist. Or
Right.
They need to work it out in therapy. Do you
Right.
believe that at all?
Not at all.
Not at all. Okay.
No.
All right. So.
No.
All right. So what's your approach? Because I know people that have it. People that are
Yeah.
close to me. People that I have heard have gotten bit twice, 3 times in their life. And
Yes.
it affects their joints, their memory, their thinking, all of that stuff.
Yeah, and I think the key to really getting better is to getting diagnosed as soon as possible and getting help as soon as possible. And I know that lots of people try to get help, but they can't.
Why? What's the problem?
Well, sometimes they go to a walk-in and they get 3 days of antibiotics, and that just doesn't do it.
No, it doesn't.
It doesn't do it.
Right.
And sometimes even 2 to 3 weeks doesn't do it of antibiotics. Sometimes people are not believed. They go to
Yeah.
the doctor and they say, I have, joint pain, I can't think straight, and, I'm depressed, and the doctor says, here's an antidepressant.
Sure.
So that happens a lot. And sometimes I have patients who've seen, a dozen doctors before they've seen me.
I have talked to someone that I'm thinking that lives in the Litchfield area, and she was bit like 15, 20 years ago, or maybe not even bit, like there's no mark, and then they found it later. And all of those tests, we can talk about that, is they didn't come out positive. There was no, fingerprint per se.
Right.
A lot of those tests don't necessarily show Lyme disease until later. I mean, there's...
So that's part of the problem.
Is it? Okay.
It's part of the problem. So the testing is a problem. None of the tests are 100%.
Okay.
Yeah, so that is part of the problem. And also, when people become chronically ill with Lyme disease, they don't test positive at all.
Oh, they don't?
They do not.
I did not know that.
A lot of them don't, because their immune system is so depressed it can't really mount the proper, whatever you want to call it, response that shows up on a Western blot.
Okay.
So the problem then is, as a practitioner, do you believe that the patient has Lyme disease and then treat them? So really, Lyme disease is supposed to be a clinical diagnosis, not a laboratory diagnosis.
In other words, the doctor looks and says, you have the symptoms,
listens
this is what we're
and
do.
hears, what the person is saying, and then
Okay.
So I typically look at people and I think clinically. If it's negative on the test, I've seen enough negatives that it doesn't really matter. I treat them anyway, or I give them a choice.
Sure.
Do you want to try an experimental month of treatment and see what happens to you?
Exactly.
Yeah.
So you're not treating with antibiotics, you're treating with natural supplements.
The natural supplements, the herbal medicine, the botanical medicine, it is antibiotic.
Oh, it is?
Oh, absolutely.
Okay, so...
They're just not prescription.
I see. All right, so it is killing something?
It's killing something.
It is killing something.
Absolutely.
Can you tell us the secrets? Could you tell us a few of the herbs or few of the combinations, or is that against your practice?
I could tell you a few. The complicated part is that every patient is different and nothing works the same.
Oh, okay.
I can't write a protocol and say, give this to every Lyme patient, because that doesn't work.
Oh, it doesn't?
No.
Oh, okay.
No.
So there's no one size fits all.
There absolutely is not.
Okay.
Yeah.
All right. So I've heard Teasel. I've heard even Sweat Lodge.
Sure.
I don't know if you
Yeah.
ever prescribe that. I've heard something moss. I'm not trying to think what the herb is. It's some. I don't know
I'm
what.
drawing a blank on the moss.
Okay. All right. All right, I think it's from memory. I'm just kidding. But there's so many different protocols.
There are so many.
So you're almost like a Sherlock Holmes and sitting there trying things.
Right. And it depends on how sensitive the patient is. It depends on, what their nutritional status is too. So I try to, when a person goes to a naturopath and they have Lyme disease, it's my responsibility to treat the immune system, to treat their gut.
Oh, yeah.
Because with Lyme disease, they almost automatically have something called leaky gut.
Yeah, what is this leaky gut? I've heard of it. I've heard doctors talk about it. I've read about it. What exactly is that?
So the gut.
Okay.
It's supposed to have really tight junctions. So you eat food and nothing can leak through.
All right.
When you are sick, the leakiness begins, and that is the integrity of the gut becomes compromised, and you get little leaks, and proteins leak out and make people sick and miserable, and they're all kind of cytokine inflammation reactions.
Okay.
And that is what's called leaky gut. And also Lyme disease patients, they become suddenly allergic to foods.
Now you said
that is part of the leaky gut.
Okay, because I remember when you did the presentation in Litchfield at the library, you said that you had a test where people can come in and it tells what they're allergic to.
Yes, and I'm talking intolerance, which is a little bit different than an allergy.
Okay, so intolerance.
Yes, a food intolerance.
Okay.
So suddenly they, all the food they used to be able to eat, they suddenly can't eat, or they have, they have reflux, they have belching, they have they have constipation, they have gas and bloating.
All right.
When, 6 months ago, none of this was going on.
Okay. So I know there's people watching, there's people listening. Can you talk about some of the symptoms in case someone is experiencing, memory loss or joint pain or whatever they are? This might save somebody.
Sure.
What are those things?
Sure, and it varies from patient to patient.
Oh, it does?
Yes, it's a huge difference in presentation symptoms. So sometimes people have a horrendous headache they can't get rid of. They might have joint pain. Mm-hmm. They might have a stiff neck is really common.
Okay.
Low back pain is really common. there are mental symptoms that come with Lyme disease that nobody really expects, and that is depression, anxiety, confusion, feelings of being overwhelmed, and inability to focus.
Interesting.
Yeah.
And why is that? It has to do with the brain blood barrier. I hear a lot about that. Is that a myth or is that true?
Well, I think that when someone has Lyme disease and they're experiencing those kinds of symptoms, it's automatically in the brain.
It is in the brain.
It's in the brain, yeah.
And what is these things? They're spirochetes or what are
So
they?
a spirochete is a type of bacteria. It's a very minute type of bacteria.
Okay.
And because it's shaped in a spiral, it's called a spirochete.
Okay. And they can hide in the body
They can hide anywhere. They
and then
can
come
hide
out later, like
They
10 years
certainly
later?
can.
Okay.
Yes.
So you're saying that if a person builds up the immune system and they take herbal protocols, that they can actually eradicate this and kill this? And
It depends on when it was found.
okay.
So if somebody got a tick bite yesterday and we started treating immediately, yes, they can get over it.
What if someone went 5 years or 4 years or 3 years and they're suffering? Can there be hope?
There can be hope. For a chronically ill patient, I would say the goal would be getting them to 95% or 98%.
All right, so-
I don't know that we can ever get them back to 100%.
It never really goes away.
Yeah.
So is this a disease that people have to be concerned about in the spring and the summer and just don't forget about it in the winter, or how does that
Well,
play
I'd
out?
like to be able to say yes to that, but I
Oh,
can't.
You can't? People come to you in the middle of the winter?
Yes. So I've had patients show up in February and they said, well, I had a tick bite on December 17th.
Is this because the dog, the cat, or what?
Dogs and cats bring it in, yep, and the ticks are still active. It's not really, it's not real. We're not in a dead freeze yet.
Okay.
So I think that as long as we're not in a dead freeze, the ticks are active.
Okay. All
Yeah.
right. So let's talk about prevention. And if someone can prevent this, is there a way? I'm sure be aware of what they're wearing. What do they have to wear? Are there natural things that you can put on your body? What do you tell your clients and your patients?
So there are lots of things to spray on the clothing.
On the clothing.
Right, and those sprays do not go on the skin because
Why? 'Cause
they
they're
are
toxic?
toxic.
All right.
Yeah.
Okay.
So there's sprays that can go on the clothing. There's actually a couple lines of clothing that you can actually buy that have the repellent in the clothing.
All right.
So that's a possibility too. I always say do a tick check after you come in from the outside, and lots of people have arranged their situation. So when they come in from the outside, they take off their clothes and they put them immediately into the dryer because the heat of the dryer will kill the tick.
All right.
So I don't really like that because the clothes are dirty, but
Yeah. So you put them in the dryer. Okay.
you should, but
Okay.
I might wash them and then put them in the dryer.
Okay.
So, and there are a variety of ways. Now, given that, I will say to you that I've had patients who say, I tuck my pants in my socks, I wrap my whole body up, I go hiking, and the only thing showing is this.
Right.
And they come back and they have symptoms of Lyme disease, and I say, do you mind if I do a test? And they say, I don't have Lyme disease.
Right.
And
So how do they get it?
That tick got in there.
Okay. And they're small, right? I mean, they're really.
They are so small, they're like the tip of a pencil.
Oh, okay. That is small. That's very small.
Yeah. So the problem is that people don't see it. In
Sure.
fact, I was bitten this past May. The only reason I saw it was because it was on my ankle and I thought it was a scab. And I came out of the shower and I thought, oh, I'll just pull that scab off, and it wouldn't come off.
Oh.
And then when I finally got it off, I looked at it and I thought, oh my gosh, there's a leg there. There are a few legs there. And I quickly, put it on a tissue, got my phone, took a picture, and blew it up, and it was clearly a tick.
Now, do people send these ticks into a laboratory?
You can.
You can.
You
All
can.
right. All right.
Yes, and there's a place called tickencounter.org,
Okay.
and you can take a picture of your tick and submit the picture. And the picture, I think it's, I can't remember who's behind it right this second. I think it's, I don't remember.
Okay.
Rhode Island University or something
All
like
right.
that.
Okay.
And they assess the tick, and they write you back within 24 hours, and they tell you what to do. They tell you whether the tick might have certain things and you should go further. Or they say, don't worry too much, this tick is dead, or,
Right.
who knows what they say, what they might say.
When we come back after the break, I want to talk to you just about other co-infections.
Yes.
Because I understand it's not just the spirochetes. There's other things that can cause havoc in a person's body. What would you think would be the greatest piece of advice you could tell someone that may think that they have Lyme disease? Run to a doctor, run to see you. I mean, how do they get a hold of you, by the way? That would be
They
very
can
important.
get a hold of me in a couple ways. First of all, I have an office in Southbury. I'm there 3 days a week.
Okay.
And it's at the Naturopathic Health Center. And I have a website, and I have
What's
a phone
the website?
The website is www.naturohealthcenter.com.
Okay.
I'm in Litchfield 1 day a week, and I'm at Blue Heron Health in Litchfield on Wednesdays, and that website is www.blueheronct.com. And I'm also available on my phone, my cell phone, and that cell number is 203-873-8050.
Now, we're in the tri-state area. If someone's in New Jersey or they're outside, can they call you? Could you do Skype? Could you refer people? Do you do that as well?
I do a lot of referrals,
You do?
and I certainly can do a phone consult or something else.
Okay,
yes.
because I know this is going to be on Facebook, it's going to be on YouTube, and so
Okay.
we might have people that are watching anywhere, Texas, California. So is this a Connecticut concern, or is this all over the United States and Europe?
Well, we definitely have an epidemic here.
We do.
Clear epidemic in Connecticut, and clear this area.
I see.
This area. There are other spots in the country that we have epidemics, including the southeastern Pennsylvania and other areas. It just so happens that my family lives in the southeastern PA, and a lot of them have Lyme disease.
Wow.
Yeah.
We will be back after this break with Alice Bell. Thank you.
Thank you.
Hi, welcome back to Mindful Conversations. I'm Greg Dwyer. My guest today is Dr. Alice Bell. We're talking about something very serious, Lyme disease. Thank you for coming back and being on this program.
Thank you for having me.
So I know people who have had Lyme disease, and I know we talked about the issue of the spirochetes, but there's also these co-infections or even yeast infections and all of these other things. What are these things that can cause havoc on a person's body?
So when the tick bites you, you might think that it's only giving you one disease, but it might give you up to 20 diseases. So many bacteria, viruses, and yeast. And so almost all Lyme patients have problems with other bacteria, other viruses, and yeast. So it's pretty common for somebody to have all spirochetal infection, bacterial infection, fungal infection, and viral infection.
Now, do you do a test? Can you do a test?
Yes, I do.
Oh, you do?
Yes.
Another medical doctor necessarily wouldn't do a test like that. Only somebody that's a naturopath.
Oh, no, that's not true.
Oh, that's not true.
No, if the doctor is familiar with Lyme, yes, they might run the test as well.
Well, you just mentioned familiar. Are there doctors that are very open-minded towards this? Are some closed-minded? I mean, do you have a full spectrum?
I would say that, so Lyme seems to be an education problem.
What do you mean?
So some doctors who treat Lyme patients do so and with understanding because someone in their family has had Lyme or they have had Lyme. Okay? It seems like there are a whole bunch of doctors who aren't familiar with Lyme, who think there's no chronic Lyme, as we spoke about earlier, but maybe no one in their family has been affected by Lyme yet.
Right.
Yeah. So I think there is some close-mindedness, and I do think it's an education problem.
Okay. So in my reading about this, I came across this whole conspiracy concept of Lyme disease, and I don't know if we want to really talk a lot about it, but there are some people that believe that this is manufactured as like chemical warfare. Do you think they're crazy? You think there's something to be said of this? I mean, it sounds fascinating, like you could make a movie out of it,
Right.
What do you think? Maybe?
I've read it all, and I
Sure.
think it's possible.
It is possible.
It's
but
possible.
You're saying that, maybe it's not true, but it could be possible.
It could be possible, and to be honest, I can't care about that.
Yeah, right.
I can't really care about where
Right.
it came from.
Right.
I have to do my job and help people get better.
So how many patients do you see a year on Lyme disease here in Connecticut? Hundreds, thousands?
I would say hundreds.
Hundreds, okay.
Hundreds,
Okay.
yes. And I would say I've diagnosed hundreds of patients with Lyme disease.
Wow.
Yeah.
Wow. So where do you think medicine is going to go? Do you think they're going to come up with some kind of vaccination like you give your dog?
They used to have a vaccination, and I think the problem with the vaccination is that people got sick from it.
Oh, they did.
And I think that they have a dog vaccination now, and I think that it's pretty successful. And I know I was talking to my sister, and she asked the vet if the vet would give her the dog vaccination.
Really?
So
That's scary.
if they could only come up with a human vaccination that wasn't harmful,
yeah,
it would be a great idea.
I think people would buy it, especially here in Connecticut.
They would.
You know,
They
they'd go
would.
in for like a tetanus shot.
Right.
Have you had your Lyme? You know,
Right.
instead of the flu shots at the CVS's
Right.
around Litchfield. Have you had your Lyme? They could have a little logo of a spider or tick. Yeah, it would sell like that.
Right.
So that's
It
where you
would.
should put your research. So let's talk about nutrition. What are some of the foods, and I know you can't diagnose because we have an audience here, you know, watching and listening, but what are some of the foods that are terrible? Now we're drinking water, but I heard coffee is terrible. Caffeine.
Why is coffee terrible?
I don't know. I think it's the caffeine or alcohol. There's certain things that are not good for Lyme disease. At least this is what I've heard.
Yes, I agree.
You
I
do?
think you're right.
Okay.
Yes. Now, some people with Lyme disease need a cup of coffee in order to get going.
Oh, really?
Yeah, because they're so out of energy that
I
they
see.
might have to,
Okay.
you know, do something that boosts them.
All right.
You know, and there are other ways to boost people's energy besides caffeine, but sometimes people lean on that.
All right.
I would say that a lot of Lyme patients become extremely sensitive to alcohol.
What do you mean? They drink it and they...
Well, they used to be able to drink, you know, 3 to 5 whatevers, vodkas a night, and suddenly they're sick as a dog after they have one.
Oh, okay.
So something about Lyme disease compromises your ability to detox.
Okay, now what about sugar? What about white bread? These are probably
Sugar
things
and white bread are not a great idea because
anybody.
Well, for anybody, but also Lyme disease because of the fungal issues.
All right,
You know, those things are feeding fungus.
all right.
So sugar, any kind of, even bread actually.
Right.
Bread, all kinds of goodies, you know, cookies, pastries.
Sugar, yeah.
Yeah, all these things turn to sugar and people crave them because of this
Right,
fungal infection they have.
okay.
Yeah, so if I try to put people on an anti-candida diet, and it's really difficult for them.
So what is that? Basically fruit, vegetables, or not even fruit because there's sugar in fruit,
Well,
right?
you can have fruit, but it has to be near protein.
All right, what does that mean?
So, and 2 servings. It means if you have fruit, it has to be of a certain type, and you can eat protein. You have to eat protein within 15 minutes.
Oh,
Yeah,
So
so that it's balancing.
it's
The
balanced.
protein is balancing your blood sugar in case the fruit is knocking it out of whack.
okay. Yeah, I studied years ago food combination.
Yes,
It seems
exactly.
very complicated.
It is complicated,
you
but
know.
it's important actually.
It is. Do you
Yes.
do it?
I do it myself,
You
yes.
do?
I do.
Okay.
Sometimes when patients are really detailed and into things, I do bring it up, and I do hand them something about food combining.
Yeah, I've seen the charts and I think to myself, I need to find somebody that will follow me around to say, don't eat that now. You need to wait 10 minutes. You know, I was like, how in the world can you do that? Like, it's just, I mean, you have to be disciplined and
You do.
focused. And,
You do.
You know,
You really do.
Yeah.
But you feel so much better when you eat like that.
Yeah. So bring us through the process. Someone comes to your office. They're having symptoms. You're clinically looking at them and going, I think this person has Lyme. What do? Do you do the blood test? Do you sit down with them and talk to them about tolerance? What's the procedure?
So I ask a ton of questions,
All right.
and then I'm required to do a physical exam too. And then after that, I say to them, after listening to all they have to say for a good hour, maybe an hour, 15 minutes. Then I sum it all up and I say, okay, so we could do this Lyme test, which is lousy, this Lyme test, which is better but not 100%. I could do food intolerances because it does sound like you might be having some reactions to foods. So I give them choices.
Right.
And I do also give prices because some of the tests are not covered by insurance.
Right, you read my mind. I was thinking
Yes.
about that. So you don't have insurance covering it, and I think at the lecture you were mentioning, you're looking at probably anywhere from $300 to $500 a month for treatment. Is that about ballpark?
I'd say yes.
Okay.
I can't really treat anybody for less than $250 a month. Yes.
That's not bad. I mean,
Yes.
you're giving somebody their life back, and
Yes.
even with that, you're educating them about food and about nutrition, and you
Right.
know, so.
And another important thing about nutrition is when somebody has Lyme disease, they really need more nutrition because the bugs are actually, or the bacteria or the viruses or the spirochetes are eating the nutrition.
Right.
So the person, if they were already depleted, become more depleted.
Right.
So it's really important to do something about the nutrition, in the beginning so that they're
Right.
getting more and they feel better.
Right.
They do feel better with it.
I think another thing is we take, and I'm speaking for myself here, we take our health for granted. You know, I'm going to be 56 this year. I feel good. I just know that, you know, if you lose something, whether it's the ability to walk, like I have a friend that's having difficulty walking, you know, a hip problem, and you just think to yourself, I've taken this for granted, and then little by little things are taken away from you. It's everything. If you can't think, if you can't work, if you can't walk, if you can't function, you can't make money, you can't do anything. So health
That's
is
right.
really important.
You're absolutely right. You're absolutely right. But I would say that Lyme patients, they're put on in a different sphere just from the experience of having the Lyme disease.
You talked about that before we went on air. What exactly do you mean that they're in a different category, they're in a different sphere? What do you mean by that?
Well, I think that they have to pay attention. It's like being kind of slapped in the face and saying, hey, wake up. You have to start paying attention to all of this stuff you never paid attention to.
Sure.
You know, including what you're putting in your mouth, what you know, the sleep you're getting.
Right.
You know, all the things that you just basically thought, oh, it's okay to eat a bowl of cereal for breakfast.
And we didn't even talk about the sleep problems. People who have Lyme.
People have huge sleep problems.
Sleep problems. They're either awake at 3 in the morning or they can't sleep at all.
That's
fatigue.
right. Or their whole sleep-wake cycle is flipped. So they're sleeping during the day and they're awake all night.
Wow.
Yeah,
Wow.
so really difficult.
Wow. I've seen people on YouTube that are in wheelchairs. They're in bed.
Yes.
I mean, it's
Yes.
that bad. And we didn't talk about this. We don't have time to talk about this, but it masks itself as far as MS and other problems where
That's
people
right.
will get a diagnosis saying, no, you have this, and it's not that, right?
That's right, and that can happen a lot. I've had several patients like that. I had one patient with quote-unquote myasthenia gravis, which is a serious autoimmune disease that affects the throat and the respiration.
Okay.
And I kept listening and thinking, she doesn't have
Really?
MG, she has something else. Anyway, we did some testing and we found she had something else.
Wow. Wow.
Yeah.
Well, I really appreciate you being on this show. I saw you give a presentation at the library. It was packed. You were able to handle the questions. Can you just give the camera your website,
Sure.
your information before we say goodnight?
Sure. In Litchfield, I am at the Litchfield Family Chiropractic on 82 Meadows Street with Dr. Nicholas Varholak, Kim Fisher, and April Blassage. And my phone number is 203-873-8050.
Excellent. Dr. Alice Bell, thank you so much. I really appreciate it.
Thank you for having me.
Oh, this was wonderful.